My name is Nathan Friedman, and I'm the CEO of HemaSense. And Joan actually presented this format to me as an idea back in November, and I was really excited about what her vision was for this, because as a CEO and a founder, we spend a lot of time talking about what we're building. And I think this is an opportunity to not just hear that from these companies, but also why we're building it and how we're building it. So today, I'm going to take you on a little bit of a journey, not just around HemaSense, but around some personal learnings that I've had over 22 years of medical device design and development. I've been in this industry a while. I've had a lot of successes over the years. I've had the privilege of being involved in some very impactful products, but I've also got a very long list of things that never saw the light of day. We're going to talk a little bit about HemaSense, but we're actually going to start with a little bit of my journey. And I'm going to put this in the context of a framework that I like to use from a mental perspective. I like these simple frameworks. And this is not some academic paper. This is something that I've kind of come to over the last 20 years of work. And it really boils down to 3 points. First is the tools. This is the product. This is the technology. This is what we're using to actually solve a problem. Tools are valuable, but they're only really valuable when we put them in the context of a real-world problem, and that's when we start creating impact, when we marry those tools with the right problem. And then finally, we want to take that impact and we want to deliver it to as many people as possible. And that is really where an impact becomes a contribution. And that's what I like to focus on. And to put this very simply, tools create impact through meaningful applications, and real contribution happens when impact is delivered effectively. Now, I mentioned I worked at Gore for almost 20 years. This is really where I think all of these ideas kind of started to come together, because I saw products where there was a piece of that equation that was missing. And that's what really stalled some of these efforts and ended up not bringing them to market. On the other hand, there's a couple products here that you see on the screen that I had the privilege of working on, including a septal occluder that seals up holes in infants' hearts from a congenital heart defect. That's a huge impact, and it has widespread adoption. It's the #1 product in that space right now, and that is a real contribution that I'm proud to be a part of. But when I started putting together this presentation, I actually thought back a little bit farther into my history. Why did I become an engineer, and what kind of sparked this idea that tools connected with a problem? And really, it comes back to my grandfather. My grandfather was a radio technician in World War II, and when he came back after the war, he ended up becoming a manufacturing machine designer at a large manufacturing facility. And he was a tinkerer, and we used to go see him every summer out in New Jersey. And he was also a bit of a pack rat. So this is his basement. This is about a quarter of his basement. And it was packed full of projects that were half finished and tools and materials and all kinds of things. And I actually credit his basement and his inspiration with me becoming an engineer, because we used to go down here all the time and we would have a project in mind. We weren't going down to the basement to find a tool. We were going down there to accomplish something, to fix something, to build something. And this is really that first major connection that I think I made with tools and applications. If you're wondering about the origin story of my mustache, you now have an insight into that too. And I can only hope that I look that good at 90 years old. This was his 90th birthday. So let's bring this back to MedTech for a minute. I'll just give you a couple examples here. The first one is, this is actually a picture from a DARPA project in the late 80s. And this was for remote battlefield surgical robotics. This was a huge project at DARPA, got a lot of funding, and ended up catching the eye of Fred Moll, who converted this and actually licensed the patents from SRI and created Intuitive Surgical. Intuitive Surgical was actually launched in the 90s as a remote surgery company. But what they quickly realized is that that wasn't the right application. There were some huge shifts that would have to make that happen and actually get adopted. And so what they ended up doing is taking that remote console and putting a 20-foot cable on it instead of doing it across the building or across the state or across the country. And all of a sudden, laparoscopic surgery, even though the physician was in the same room, really took off. And I think this is a great example of where they had the right tool, but they didn't necessarily have the application right. And when they married those two things up, Intuitive is a huge force to be viewed at this point. They are the #1 in the market, and everybody's kind of chasing them. So let's talk about how this converts into contribution. I'm actually going to go back to another Gore story. As a lot of you know, Gore has a very unique culture, but they also have a very unique way that they used to use every year of evaluating people's contribution and how they would get compensated at the end of the year. You were asked to actually rank all of your peers every year based on their contribution. Now, this seems like it may be a pretty easy exercise, but I always struggled with how to make this not a popularity contest. You work with all these people, project managers, engineers, technicians, admins, and you say, how do you rank those contributions against each other? Well, I had an office mate, his name's Jason Nackard, still good friends with him, had a beer with him last Friday. And when I shared an office with him 20 years ago, he said, the best way I have found is this very simple equation. Contribution equals impact times effectiveness. And he actually had a Post-it note and he'd put it on his monitor while he did the rankings. And this was very valuable for that exercise, but I think it also summarizes how impact turns into a broad contribution. We have to deliver that impact effectively. I'm sure you all know what this is. Google Glass. Maybe you remember when Google Glass was going to revolutionize surgery. Physicians were going to have the information they needed when they needed it right there in front of them, no matter where they were looking. On paper, it was a great impact. The delivery, on the other hand, was a complete flop. It was workflow changes, it was integrations that were incredibly difficult, and I don't know that anybody really uses this in surgery anymore. And it's because that impact was not able to be converted into a contribution. So I promised we'd make it back around to HemaSense. So I'll give you this context overlay on what we're doing here at HemaSense now. So I'm going to give you the origin story of HemaSense. This is where it all started. These are my three co-founders. You have a Dr. Anita Asgar, who at the time was at Montreal Heart Institute, Ben Trapp, our CTO, and Cody Hartman, who's an advisor. The three of them sat down for dinner one night, a little over 2 years ago. And Ben and Cody asked Anita, what's a problem you don't have a solution to? That simple question drew out where is an area where we can make an impact. And what she said is, I have access to all these incredible devices, all of these things that save people's lives by curing an insufficient heart valve or opening up a chronic total occlusion. But at the end of the day, when I send those patients to recovery, I will often get a call at 3 a.m. that says, we have a patient who has a bleed where that catheter went into the femoral artery. And we had no idea what was happening. We need to send them to surgery. We need to give them a blood transfusion. What do you want us to do? And she said, this is the thorn in my side. So at this point, Ben and Cody walked away from this meeting. Admittedly, I was not there, and they called me. And they said, Nathan, can you help us figure out if this is a problem worth solving? I said, sure, I've done this before. Turns out, this is a big problem worth solving. There's a lot of impact if we can solve this problem. A couple million procedures every year at a very, very high rate of bleed. 1 in 10 patients will have one of these bleeding complications. So we actually started with the impact, and then we worked backwards, and we said, what are the right tools to get this impact? And really, what ended up was that tool was sitting right under our feet. Body composition scales use a technology called bioimpedance. It uses a small electrical signal to differentiate the different tissue types in your body, and that's how you get % body fat, water content, all that kind of stuff. We miniaturize that and put it on a device that's disposable and can be placed on a patient after this procedure so that they can then detect when there is blood accumulation below the surface of the skin to help these complications get treated before they become consequential. Ultimately, when we look at impact, we are impacting patients. They have better outcomes, they have shorter hospital stays. We're also impacting physicians because they now have confidence that their closure worked and it was durable. We very greatly impact the nursing staff because right now they're relying on checks that are very subjective and intermittent because they're visually inspecting the access site, and that's the only way they detect these right now. And finally, we also impact the hospitals. They're the ones who bear the brunt of this cost. They're the ones who have a vested interest in turning over more beds quicker because it helps increase their efficiency as well. This is one product that has impact across all these stakeholder groups, and that's really what we strive for. But at the end of the day, we also have to keep in mind that it doesn't matter how impactful it is if we can't deliver it. And this is really where the rubber hits the road for most of us as founders and as startup operators. I'm going to give you a list of the things that are on the top of my mind right now at HemaSense. But at the end of the day, this list is going to be a little different for every startup. I'm not going to read these to you. I'm not going to go into detail. But what I am going to say is this is where most startups die, figuring out how to deliver that impact. This is what we talk about when we talk about regulatory and we talk about reimbursement and we talk about go-to-market strategy. All of these things have to come together in a way where you can actually deliver that impact to the people who need it. So I'm going to bring you back to my original slide, which was our mission statement here at HemaSense. Our mission is to improve patient recovery through actionable insights. That is the impact we want to have. But there's another statement that every company should think about that goes along with that mission statement, and that's the vision statement. And that's what should talk about how you are going to convert that impact into a contribution. Here at HemaSense, we want to deliver this technology to as many patients as we possibly can because we believe that we will make an impact in all of those patients' recovery. So our vision statement is big, it's bold, it's audacious, but we will become the standard of care following these femoral access catheter-based procedures. Thank you for your time.